Staff of the Pantang Hospital resumed work from their strike following assurances by government that their demands to have the hospital fenced will be addressed. The staff feared for their lives as they complained of attacks on them by some persons. Encroachers of the land were subsequently given deadlines for evacuation. However, the encroachers are yet to relocate, and that is stalling the processes to fence the hospital. Speaking to Citi News at the sidelines of the commissioning of an 18-bed COVID-19 treatment and isolation center, the Deputy Director in charge of administration, Colin Skese, urged the government to address the long-standing concern of the hospital staff.
We want to say the government has done well by responding to some of the concerns of the staff, especially the enhancement of security situation. As we speak now, we have security on the ground, and then our police posts are also being manned by security personnel. But regards to the fence wall, even though the contractor is on site, but the land available for him to construct the fence wall is a challenge. We have some structures hindering him to steadily progress with the fence wall construction. And until those structures are demolished, it will delay the progress of the fence wall.
The renovation of one of the hospital's ward into a newly commissioned COVID-19 isolation and treatment center at the cost of 806,600 Ghana cedis is to combat the threat the virus poses to patients and manage potential outbreak. The chairperson of the Board of Trustees of the COVID-19 Trust Fund, Her Ladyship Justice Sophia Ekufu, retired, said the move formed part of government's efforts to alleviate pressure on other COVID-19 treatment facilities in the country.
Firstly, this is a hospital, and it's a hospital with some of the patients being long-term patients. And so if any of them were to contract COVID, which is possible, now there's no need to take them out of the confines of this place. There's the center where they can be isolated, they can be observed, and if they are found to be, yes, indeed, with COVID, then they can also be treated. So it's both an isolation center as well as a treatment center. And also people in the community who may contract, because with this Delta we have had weeks when every treatment center is full. At least now we have one more treatment center to help alleviate the problem.
Meanwhile, the acting clinical care coordinator for the Pantang Hospital, Dr. Julius Hache, appealed to the government to provide the hospital with oxygen treatment plants as the hospital depends on external suppliers.
One of the things that can hinder the caretaker, the taking care of patients, is that when we don't have a continuous supply of oxygen. A common complication of COVID-19 is respiratory distress. And when that occurs, it is very important that you be able to get oxygen to deliver to the patients. But unfortunately, we don't have a continuous supply of oxygen as a hospital. So we are appealing to the National Trust Fund of COVID-19, as well as the general public, the whole nation, anywhere and anyone who can help us to get an oxygen plant on site to deliver oxygen continuously at this isolation and treatment center. Our arms are widely open, and management of the hospital will cooperate with the person in order to do that.
Management of the hospital are hopeful that the COVID-19 treatment and isolation center will go a long way in the fight against COVID-19, but the hospital is also urging government to expedite processes to have the hospital fenced. Reporting for Citi News, Beverly Langdon.